Hi, my name is Eleanor Shaw, and today I'm going to be discussing DV2 prophylaxis in the hospital that I currently work at. So, the DVT prophylaxis order set and protocol was implemented in the early 2000s after hospitals started noticing an increase in the number of patients admitted who suffered from DVT and PE that could have been prevented. The order set includes heparin, Lovenox, and non-pharmacological interventions such as SCDs, TEDHOs, and early ambulation for patients who do have an increased risk of bleeding or drug allergies. The hospital I'm currently working at is using outdated medical charting system called Meditech, and it's the very basic version. So they have not had any order sets, and in the last 6 months, they did hire an informatics team to consist of a clinical nurse educator who is going through to try to implement standard order sets that you would see in the hospital setting. And so they did include a DVT prophylaxis order set on the admission protocol, and that has helped physicians and nurse practitioners remember to implement some form of DVT prophylaxis. Before this, providers had to remember on their own to add a DVT prophylaxis into their basic order sets, and oftentimes they were forgetting. Although this implementation has happened 6 months ago, the informatics department does not have enough information yet to support this standard order that has been implemented. However, across the United States, you will see that there has been enough research to implement that this is appropriate and is needed as a standard order set. Key patient safety measures include, according to Kakar and Haas, the risk of thromboembolism can be estimated based on patient and procedures specific risk factors and the use of assessment tools such as the Carboni score. So when we think about the risk factors that are associated with DVT and PE, age, obesity, smoking, pregnancy, cancer, family history of clotting disorders, thrombophilia, and estrogen use all can contribute to the patient being at greater risk of developing DVT, along with prolonged immobilization from surgery, or if their occupation, such as truck driver or something along those lines, prevents the patient from moving around, they are again more prone to getting a DVT. And in the 2000s, the Joint Commission and National Quality Forum, NQF, established prophylactic protocols to prevent DVT and PE and labeled it as a key safety measure that all hospitals should follow. The computer charting system is outdated that we are using, and so it does not have a calculator to help compute the Carpani score where I work. But there is a phone-based app that could help implement this evidence-based practice, and although our hospital does not have the Carpani calculator or any risk factor calculator at that point in our charting system, we have a free phone app that we can use to accomplish this. The one that I'm currently using is MedCalc, and I use it quite often for CHA2DS2-VASc score, Carpani score, heart score, and those type of scores. So you can click on this link here to pull up the Carboni's score, but it is for thromboembolism, and it last was updated in 2025. This calculator takes in the risk factors that I talked about before, and then computes a number to decide what is the patient's risk factor of potentially getting a DVT or PE. And then based off that risk factor, gives recommendations such as medications versus TEDHOs or SCDs or early ambulation. There's a nursing order set that does implement evidence-based practice related to DVT and PE, and that nursing set is activity orders and early mobility. And again, something that they did put into practice is implementing these order sets on admission, so providers don't forget to document how often do they want the nurse to get the patient up and ambulating, with how many people, with assistance, without assistance, and based on their current surgical and medical condition, what is appropriate for them as far as early mobility. So I have a reference page here for you. If you have any questions, feel free to send me an email. Thanks for your time.